we would like to take a few minutes to pay tribute to some of the exceptional COVID-19 warriors. Our board of directors, Mr. Suhas Tuljapurkar and Mr. Ramesh Sharma, welcome Mr. Prakash Singh, Mr. Raman Gangakhedka, Mr. N. Ramachandran, Mr. K. Venkatesham. Let's hear their message to us in the midst of this pandemic.
Namaste, ladies and gentlemen, and welcome to this Compliance 1010 event. I'm privileged to have with me my friend and my batchmate, Mr. Ramachandran, with us. He's an IPS officer who has served with great distinction through his entire career. He retired as DGP Meghalaya, and after retiring, he did not sit quiet at home, but founded a think tank called Indian Police Foundation, which was inaugurated by the Honorable Home Minister of India, Mr. Rajnath Singh, in October 2015. And ever since then, he has been relentlessly pursuing as a think tank, associating a number of retired and serving officers in pursuit of how to bring about excellence in policing, how to make the police more people-friendly, how to make it more efficient and effective. For Mr. Ramachandran and for the audience here, a few words about the event, Compliance 1010. This event was conceived by Mr. Suhas Tuljapurkar, who is the founder director of Legacy Services Private Limited. He is a corporate lawyer, well known at that. And I call him a compliance ideologue par excellence. He is the one who conceived of this notion of holding this event on the every 10th day of 10th month, that is 10-10, which symbolizes also that as far as compliance is concerned, you cannot have compliance 9 out of 10, it has to be 10 out of 10, because even one compliance can lead to disastrous results. On this day, we celebrate the compliance professionals, the companies which are compliant, and we give out 80 awards this year. We are going to give out, and these awards are kind of candles that we light, which we hope in turn will light several thousands of candles and several lakhs of candles to dispel this ignorance about compliance and to bring about a sea change in the compliance in the corporate world. The highest award that is given during this occasion is the Compliance Crusader Award. And you'll be glad to know that this award in the past have been given to industry stalwarts such as Dr. R.A. Mashelkar, Mr. Deepak Parekh, Mr. Narayan Murthy, Mr. Damodaran, Mr. Adi Godrej, and Ms. Anu Aga. The reason why we are holding this small little event is we in the Legacies, the Bombay Stock Exchange, which is our event partner, and more than 1,000 companies felt that we have to salute and felicitate and express our gratitude to the Indian police force, which has worked so tirelessly and exposed itself to such risks during lockdown and even thereafter. We want to express our gratitude on this occasion, and we also want to honor the Indian police for keeping us safe during these turbulent times. I would now request Mr. Ramachandran to talk a little about his experience, his knowledge, because he's been pursuing this subject very avidly throughout the COVID times. Over to you, Mr. Ramachandran.
Thank you for this opportunity. Ever since the COVID-19 pandemic broke out, you must have seen our police forces on the front lines doing everything possible to prevent the spread of the virus and protecting our citizens. Although the police themselves had very little prior specialized training, they very quickly adapted fairly flexible practices to implement the lockdown, enforcing social distancing, contact tracing, creating public awareness, managing containment zones, protecting hospitals and health workers, as well as most importantly, keeping the essential services and supply chains functioning. It's very important. You might recall that during the very early days of the lockdown and when the migrant crisis erupted, the police forces throughout the country rose to the occasion, carrying out extensive humanitarian work, providing shelter, reaching food and medicines, and various other forms of help to those in need. You will all appreciate that the very nature of policing profession itself, makes the police personnel particularly vulnerable to infections. They are required to physically stop crowds, grapple with demonstrators, often assist in transporting the sick people to hospitals and even transporting dead bodies. So you will know how vulnerable they are to this virus infection. I must inform you today that more than 700, in fact 710 persons as of yesterday, 710 police personnel have lost their lives due to COVID-19 pandemic. And almost 140,000 police personnel have been infected. Police and CAPF personnel have been infected during this pandemic. This means that police personnel account for 2% of the total COVID-19 infections in the country. That is a huge number. 2% of the entire infections in the country are police personnel. But what is important is that in spite of suffering such large numbers of mortalities and morbidities within the forces, our police personnel continue to display the highest standards of dedication, motivation, and commitment to very selflessly serve and protect our people. Their levels of enthusiasm and devotion remain as strong as they were in the beginning of the pandemic. As I was mentioning, the Indian Police Foundation has been tracking the number of mortalities and morbidities in the police forces because of this COVID-19 pandemic. And right from the beginning, we started under the Indian Police Foundation website, we have started a COVID-19 dashboard, which gives updated figures of morbidities and mortalities on a daily basis. These figures, as well as the documents that we have on pandemic policing, are available for research and development, and especially for future police research. Now, as far as the Police Foundation itself is concerned, we have been extremely, interested in focusing on these morbidities and mortalities within the forces, because we believe that if the number of infections are not kept under control, it may affect the long-term operational continuity of police forces themselves. In fact, last month we had conducted a major conference in which 7 DGPs of various states and cities, police commissioners had participated, in which these strategies were discussed. So as far as the Police Foundation itself is concerned, as I was mentioning in the beginning, we have this institution is not an exclusive policemen's club. It is a multidisciplinary group of professionals, both police officers as well as senior civil servants, academics, lawyers, industrialists. I mentioned to you, Mr. Deepak Parekh himself is one of our esteemed members, and he is one of the members of the IPF executive committee. So like that, we have some very respected, eminent persons from across the country who are giving the strategic direction and governance of this police foundation. Now, coming back to this endeavor of legacies, I must say that it is extremely thoughtful on the part of legacies to have recognized the sacrifices of the Indian police and to have decided to pay homage to this large number of police personnel who have made the supreme sacrifice in the line of duty, and also to honor those who have fought and conquered the infections. So thank you, legacies, once again. The Indian Police Foundation will very solemnly do this duty to convey your gesture of recognition to all police chiefs of states as well as central police organizations. Thank you very much for this opportunity.
Thank you very much, Mr. Ramachandran, for being with us today and finding time to give your message and the message of the IPF, which is in fact doing an excellent job. And I don't think there are any other think tanks in this country which is totally devoted to the police cause and police reforms. We are very happy to hear that you will be conveying our message to the various police chiefs and of the states as well as the central police forces. Thank you very much for being with us.
Thank you.
It's my privilege and honor today to have Mr. K. Venkatesham, who was the former, till very recently, former Commissioner of Police, Pune. And since I am based in Pune, I'm quite aware as a citizen of this city, the innovative initiatives that Mr. Venkatesham has taken in this city. Not only during the COVID times where he ensured police health and minimized the affliction due to this terrible pandemic, but also apart from this, I'm quite aware of how he came out with innovative solutions for senior citizens, for women, and for all those weaker sections that needed his help. Prior to this posting, he was Commissioner of Police in Nagpur, where also he was widely acclaimed and his work was widely recognized. I can go on and on talking about the distinguished service of Mr. K. Venkatesham, but I'll give it a pause here and talk about this particular event, Compliance 1010. As you are aware, this event is held on the 10th day of the 10th month every year. This is the 7th edition, and the 10th day of the 10th month translates into 1010. So it is Compliance 1010. This is also very significant and indicative of the fact that compliance cannot be 9 out of 10. It has to score 10 out of 10 marks, because even one non-compliance can lead to disastrous results. This whole concept was conceived by Mr. Suhas Tuljapurkar, who is a well-known corporate lawyer, and I choose to call him a compliance ideologue par excellence. He thought that an event like this should be celebrated every year to congratulate compliance professionals and to spread a culture of compliance in the corporate world. During the occasion, we have master classes, master quiz, we have panel discussions, we have keynote speeches by eminent people, and we also have panel discussion on independent directors. Apart from the 80 awards that we give, this year we are giving out as many as 80 awards. And with these 80 awards, we hope to light 80 candles. And in turn, we are optimistic of the fact that these 80 candles in turn will light several thousands and several lakhs of candles of compliance, of the message of compliance, of the culture of compliance in the corporate world. I must say here that the highest award that is given is that of the Compliance Crusader Award, which in the past have been awarded to industry stalwarts such as Dr. Mashelkar, Mr. Deepak Parekh, Mr. Narayan Murthy, Mr. Damodaran, Mr. Adi Godrej, and Ms. Anu Aga. Why we have invited Mr. Venkatesham, this distinguished police officer amongst us, is that we in the Legacies, as well as our partner Bombay Stock Exchange, as well as more than 1,000 companies with us, we felt that this is an appropriate occasion to express our gratitude to the police forces of this country, and particularly to the police forces of Maharashtra and Pune for the excellent job that they have done by risking their lives in trying to keep us safe. So it is as a matter of gratitude and to honor the Indian police that we have amongst us today, Mr. Venkatesham. I would now request Mr. Venkatesham to say a few words and give his message to the people at large on this occasion. Over to you, Mr. Venkatesham.
Thank you very much, sir, for inviting me for this Compliance 10-10 event. And this we are celebrating in 2020. And we started with 2020 vision enunciated by Abdul Kalam. And after that, we missed that vision. And now we have had to face COVID situation, which is completely unique to the world. Pandemic, which we heard or read in history in 1918 and till 1920. Not many details are available, but whatever we have heard, we were learning from that. When COVID struck, first case in Pune was reported on March 9. And I'll be mostly talking on the COVID and its the way police and Punekars reacted or responded to it. That is the thing I'm going to talk on this occasion. It was completely new. How it spreads, it was being formulated every day. WHO and ICMR were coming with new guidelines. With those guidelines, it is new learning every day, new unlearning, and something new to be learned based on the day's experience and also experience of the doctors and guidelines from various expert agencies. So first thing came on 9th, first case came. After that, we started along with other members of the administration. What way we should react? First was the imposing of 144. That's what we thought even before lockdown was being discussed in the entire country. So we prepared a document, and this is a different 144. 144 is a common parlance we call curfew, as we all know. So curfew is imposed in communal situations where the prime purpose of curfew is to create terror amongst the minds of people. So if the government decides to impose lockdown, wherein people are asked to stay at home, completely vibrant life has to put to a complete pause. It's very, very difficult. There are pregnant people who require visits to hospitals, diabetes patients who require weekly twice or once they have to go for dialysis. There are people who are planned for chemotherapies, planned for heart surgeries. There are many marriages to take place, many events, life in entire government. So every individual has a particular need. Some are emergencies, some are urgent, some are absolutely required. And for many people, lower class and middle class, day-to-day earning was important. So during that time, the lockdown was imposed. So we had to maintain, people will stay at home so that spread of COVID is less and less. So what we said is, okay, we sat with our officers. That one, 23rd was Janta curfew or something like that. But on 9th, first case came. By 11th, our meeting was on Google Meet, not the weekly meeting, which we 150 officers sit together. We said we will do on Google Meet and talk. So first, let's follow. During that time, we decided our approach in this peculiar and unique circumstances will be polite but firm. We have to be extreme polite and be helpful to the people. Generally, police main duty is maintenance of law and order, prevention and detection of crime. Service of citizens has been taken foremost place during this time. So polite but firm. So while we are ensuring that people are at home, we wanted to ensure that their absolutely urgent requirements are taken care of while sticking to the guidelines which are issued for COVID. So on second day itself, we started WhatsApp number wherein people can approach in case of emergency so that they can be facilitated. By third day, we had a great company in Pune, M.B.B.S. Say they created digital pass system because our service is very clear. We have to serve with the dignity. Nobody, if a person has an emergency in the house, we need not beg somebody or request some influential person, or through some other means he will get the digital pass, not the fair means. So we created digital pass, which was absolutely based on the merit, and we could give in the entire lockdown period, the 3 lockdowns which we had, more than 5 lakh people. 8 lakh requests we handled, 3 lakh we could not accede to their request because we felt that they were not genuine, but all others we facilitated. This is one example I am giving. While doing this, the primary purpose is police, what the lockdown, we ensure people are inside the house. The second requirement people came up with was daily wagers not getting food, transgenders not getting food, sexual workers not getting food. So those people our officers came up with the idea that we will establish a social policing cell. We established a social policing cell which was non-existent for this purpose. We facilitate through the help of corporates, NGOs, we created a facility that anybody requiring food or groceries can call that number and our people will coordinate and get it delivered. Likewise, 16 lakh plus people, groceries or food packets were provided during this lockdown. This is a number which I have, which is a very, very big number when compared to other agencies. But in that, NGOs played a major role and our constables played a major role. But during the entire lockdown, what we have seen is constables and officers coming out of their way and doing things which are beyond their family, beyond the duty, beyond the normal expectation. So what, for example, I will give you 2-3 examples in this. One day during the lockdown, a call came from Mumbai. Somebody was asking me, sir, we require medicines. From Mumbai, it call came, and there is a thalassemia particular medicine which is available in Pune, not in Mumbai, and they wanted me to take it and supply in Mumbai. So actually, to be frank with you, I shouted at him, if we are having our own problem in Pune, how can we help in Mumbai and taking medicine and sending somebody? But I saw in my WhatsApp, he has already sent me message. So I just forwarded it to my social policing cell and I did not tell them anything. But I found after 2 hours, this person calls me, sir, thank you very much, and medicine is received. What are you talking? Sir, आपको बता दिया, आपका ऑफिसर आके मेरे को दे दिया मेडिसिन मुंबई में. So that is the level of commitment we have seen. One blind lady in Hadapsar area wanted her mother and father who were stuck in Sholapur to be brought so that they can come and take care of her. So we can say we have given permission, they can come. But during that time, there was no vehicle, no buses, no scooters or no jeeps which were running. One of our constable went with his vehicle, jeep, and took that family and dropped them at their places. These are 2 examples. Many stories you must have read in the newspaper. Helping the patients get the beds, helping people connect with their NRI children in the abroad, performing last rites of some of the people who died because of COVID. So many sort of service exemplary examples we could see during this time. Like sir said, more than 12,000 senior citizens who are registered with us. They were called every third day or seventh day to guide them what sort of care they can take or whether they require any help. Many people wanted somebody to go and take out money from ATM and give them. So that money was being given, medicines were brought and given. So likewise, more than 12,000 senior citizens who are registered with a Bharosa cell of Pune police, they were given help in all sorts. Mane, there is nothing which was asked, ये police का काम नहीं है, ये police का काम है. If a person is requesting, making some request, it was acceded to. This was about social policing, enforcement of lockdown. Third major issue was migrant population movement. So migrant population movement, we saw in some of the big metro cities, people walking on the roads, sleeping on the roads, walking with barefoot. But here in Pune, we saw our own constables and officers. They were going with buses along with the jeeps. And in the evening, they will go out wherever people are seen. They will be taken to the shelter, given food, and given their mobile number, and assuring them that your transport will be arranged in a day or 2 or 3 days. But till then, shelter is there, food is there, so you need not worry and go out on the road. So basically, while serving, we wanted to maintain their dignity, and which we could achieve. We did not see many photos of migrant population walking on the roads or sleeping on the roads from Pune during this time. That is, migrant population is the third thing. Fourth was in COVID, we have seen if I am getting positive for the corona, the contact tracing is very, very important. Internationally, if I have contacted corona, though at least 17 to 18 my contacts have to be traced. This is the mandate given to municipal authorities. So we formed a cell in crime branch, facility for accelerated contact tracing, FACT, and this has traced contacts of more than 2.25 lakhs during this time. Every day they will take out, if X person has become positive, so they will trace out his contacts and give the contact numbers and the addresses of those people, so that those contacts could be checked for any symptoms of these things. Fourth was important. This is about FACT, contact tracing. Fifth was slums created a peculiar challenge. In slums, physical distance maintenance is very, very difficult. Then educating them is a little difficult because we have to burst the myths of WhatsApp messages and tell the truth, what is happening, what sort of care is required to be taken. And that has to be contemporary. We cannot just tell these three things and forget. We have to tell in this slum, so many cases have become positive, so many contacts are traced. These are the measures which we can take and this can be prevented. And ex-slum, these measures were taken and today the cases are coming down. This sort of contemporary messages we were communicating with smart bikes, loudspeaker, and somebody will go and speak in native language, or some video we will create a positive person and recovered. He will tell what sort of care should be taken. So it was outreach program is a continuous thing. And in slums, we identified causes of spreading. The basic, apart from the proximity, we found that community toilets are the major thing which were creating problems. So we created an army of more than 6,500 special police officers who are citizen volunteers and specially authorized by Commissioner of Police as special police officer. And they would go around in the area and communicate to municipal authorities about this community toilet is not cleaned or what measures have to be taken continuously on this basis. So they will not give, we are all familiar in corporate world about to-do list per day or per month or targets, key result areas and all those things. Here we created DIN reports, do it now, there is no time. So if the toilet is not clean, the photo is sent in that WhatsApp group and somebody will monitor that it is done immediately. These are all beyond the regular work of police. We said whatever is required, we have to do. That is the reason. So slum policing, DIN reports, then spreading the messages, making them aware of the things. These were the things which were being done. While we are doing this, in society there are various types of people. Collaboration is important. Doctors require different sort of assurance from people because nobody will go and beat them up, and they require facilities in hospitals that we facilitated. Then go for and other e-commerce, the people wanted help in the form of facilitating their supplies and also giving permissions to the boys, delivery boys. That was done by having their meeting. We had meeting later on when in the May opening up started. We had continuous collaboration with various shops and grocery people, essential supplies, basically milk and vegetables. These were all new challenges. Every day something will come. We will find a solution so that it will be sorted out and causing minimum inconvenience. Many societies we facilitated vegetable and grocery supplies to their gates so that they can take from the persons itself. Then dial-a taxi we created, which is sanitized, providing sanitized vehicle on the lines of Ola, Uber. The dial-a taxi was peculiar to Pune, which made more than 16,000 rides during that time. So these are the various things which we had done, which were beyond the normal. But what we witnessed during this time is, as a leader, I can claim that all this happened because I was directing my force. But I'll refrain from that because fact is a different thing. Here we have seen, during this time I was asking one of the constable, ये काम पूरा तुम्हारा नहीं है, अपना पुलिस का काम ही नहीं है, अपन क्यों कर रहे हैं? लोग दूसरा माने कोई बूढ़ी औरत को जाके मेडिसिन देना या किसी को जाके कपड़े लेके आके देना है या सामान लेके आके देना, या हमारा काम नहीं है, क्यों कर रहे हैं? तो ही सेज इन मराठी, आता नहीं तर कधी, माने if not now, when will we do? This is his attitude. And public also, we saw everybody, corporate world, citizens coming out and telling, sir, police station mein jaate hain, they come to our office and say in what way we can assist other people. So many people have adopted slums and given, okay, entire sanitizers and masks we will provide. Some of the slums were adopted by people. So all this, what we have seen, other day I was reading. So I requested Symbiosis Institute of Management to do research on this. Why people are behaving this way? They want to help others beyond their own duty. Because in every crisis, we always feel that people become naked. They do all sorts of crime and they just want to loot others. But this time we saw, the examples were quoted of Orlan floods. But we saw something different. Human beings are nice, decent, and helpful. So we wanted Symbiosis Institute of Management to do research, and they have collected data and they are coming out with their findings. But during this time, in the last 15 days, I read that Humankind book by Robert Bradger or something. So he talks entire book ki every event, every crisis, human being is a decent and helping others. Every crisis shows that people want to help others, and which we have seen during this time. Be it corporates, be it doctors, be it administration, be it police, right from constable to DGP, everybody wants to help out of the way. So from this also, last 5-6 items which I have mentioned. Now during this time, our Pune police is helping people with plasma donation. They have created a website where people who have recovered from COVID register their names for donation, and people who want, they will register their names for requirement. Though it is matched, and they will talk to each other, and the plasma is provided. Last, when I left, more than 259 people were provided through this. This also dignity. Person need not beg, hang around, roam around, circulate his number on WhatsApp. He just registers and police officers are ensuring that he gets plasma if required, if it is advised by the doctors. Mane, entire event has shown that service is supreme and human beings are decent, and police, if required, will go out of the way to help people. Thank you very much.
Thank you very much, Mr. Venkatesham, for sharing all your experiences. And I've been a first-hand witness of all that has been happening here in Pune. And that is why we thought of you as the ideal police officer to come and talk to us and talk to the people. And through you, we want to express our gratitude. Obviously, you have given us some insight into how policemen have risen above their duties that are prescribed to them. They've gone out of their way. And what I liked about and what you said was that human beings are basically good. We are basically good. And when crisis comes, we do respond in a very humane manner. Thank you very much for being with us and sharing us with your thoughts. And through you, we express our gratitude to the entire Indian police force, particularly those of Maharashtra and of course Pune. Thank you very much.
Thank you very much.
Thank you very much, Dr. Sanjay Oak, for being part of this program, this event that we have. Just to explain where we are coming from, you see, Compliance 1010 is actually celebrated every year on 10th of October as the Compliance Day, where the professionals, the corporate professionals who actually comply with all laws, and I think that's true. Even we have some of the hospitals as our clients, and we have been trying to articulate that on compliance, you have to score 10 on 10. 9.99 is not acceptable. It's probably the same as in the healthcare industry or as for doctors, that every patient that comes to you, you have to score 10 on 10. 9.99 is not acceptable. I think it is with that view. About 7 years ago, we started this campaign of creating awareness across almost about 1,000 plus companies that we work with, and a lot of corporate executives join us in trying to understand and create knowledge session, in trying to kind of make sure that we are doing right things. We are looking into mirror and saying that we are not going to compromise on compliance. We're not going to compromise on ethical aspects. So every year we give Compliance Crusader as awards. This year, obviously, the event is digital in its nature. But we thought we would fail if we do not kind of recognize or say thank you to all those doctors who have tirelessly worked during the lockdown period, during the COVID-19 period, and who have actually saved us. We know even amongst the doctors community or healthcare specialists, the people who have lost their lives, but they continue to render the services. Now, we can't obviously go back and say thank you to each and every doctor, but we thought that we would call you here and request you to accept our gratitude. Sir, this is a gratitude from not only Legacies and Bombay Stock Exchange, but it's from those 1,000 plus clients that we work with. The corporate sector didn't have too much of an opportunity to say thank you. Sir, we just want to express this gratitude and probably listen to you as the kind of head of the task force in state of Maharashtra. You had some challenges that you have tackled. We have had tremendous misinformations that floated around, plus a lot of people became aware as well as to what they should be doing, what they should not be doing. But still, I think the challenge is not over. We are still grappling, we are still struggling. Probably there is one thought process that we've had some learning thanks to you and entire kind of doctors community. We've had some good learnings till now, but that's not going to be enough. Probably we still have a larger challenge to face. And sir, we would like to therefore, if there is any message that you would want to give, we would be happy to carry this across. but completely we are overwhelmed with whatever all the doctors community have done. And on everybody's behalf, thank you very much once again, sir. And saying thank you is not going to be enough for any one of us. We would continue to be very, very grateful. Sir, over to you.
Thank you very much. Really, really thank you very much. Right at the earnest from the bottom of my heart, on behalf of the entire medical fraternity, convey my gratitude to Legacies as well as our BSc partners who are honoring us today. Any honor ultimately gives you a stimulus. But you know what is the best award? The best award for any work done is truly an opportunity to do it more. And that's the way the entire task force and the medical fraternity is looking at the pandemic. Well, when we started way back in March 2020, none of us actually knew what we are going to work against. And then there were myriad of problems. We didn't know the virus. We didn't know whether it will sustain Indian summer, Indian winter, Indian monsoon. But it has proved us wrong. We expected a touchdown sometime in June, but we haven't really seen it, even in September. So I'm quite often asked questions as to, sir, when would the second wave come in? I smile and say, oh, I don't know whether even the first one has ended. And that's a fact of life. What we have got is a fair amount of understanding of what causes it and what makes it spread in community. So we are clear about the preventive aspect of the pandemic. We have had several medicines to our disposal, but by far and large, we know that unless and until you choose correct drug at the correct timing and give it in the correct dosages, the drugs are unlikely to work. So the only medicine which has really proved the test of time till today is Remdesivir, which is to be started on the second day and not to be given beyond the 9th day. Now this is where people have gone wrong. People have started medicines late, have given them in inadequate dosages and have stopped them early, or have given them too late when the viral replication is over. People often ask me, why these discrepancies of age? Why most of the people who have died are beyond 55 and 60? And the answer is that it's not the virus that kills. It is the comorbidities and the complications that eventually kill you. India is a capital of diabetes, and so is Mumbai. Plus the stresses of everyday life, more than 50% of us are knowing or unknowingly hypertensive. So it is the hypertension, diabetes, thyroid problems, and obesity which complicate the issue still further. And what begins after second week of illness is the immunological response given by the body, which in our parlance we call as cytokine storm. It is this cytokine storm that kills an individual. So therefore, can we take this particular problem lightly? Certainly not. Significant number will be asymptomatic and significant number will be mildly symptomatic. More than about 85% of them. But they do need to be even under or in contact with a healthcare professional. So when you opt for a home quarantine, you undertake a responsibility to remain quarantined and to remain in contact with your healthcare advisor. All these points of sharing the same washroom with other family members, coming out in the night to see the TV serial, joining the relatives just for a sake of dinner, they defeat the very nucleus of home quarantine, and that is why the disease spreads. If I get one positive case, I'm supposed to track 18 contacts. And if I track less, the disease spreads. That is a problem just now in our country. We are testing less and we are tracking less. And all our efforts of the task force are geared up right from the word go, is on aggressive testing and active tracking. Let's not be afraid of positivity. It's not a sin. If you are positive, all that you need to do is isolate yourself and put yourself on appropriate medicines for a period of 2 weeks, and you would be walking back healthy. Some of us who have had to go a moderate or a severe type of disease have had a very stormy period. Unfortunately, we have lost a few. But even those who have survived are expected to have some kind of sequelae. That is what is called as post-COVID syndrome. Now, this can go on as long as 80 to 90 days. And this period is critical. You may have a cough. You may have difficulty in breathing. Your voice, timbre and pitch may change. You may gasp for air while talking. You may feel extremely fatigued and drained out, kind of fatigue which you have never experienced in your life. You don't feel like walking from room A to room B in your own apartment. All these are indicative of post-COVID syndrome sequelae. So almost all the hospitals now, in public as well as in private sector, have opened up special OPDs of post-COVID syndrome monitoring, and there is medical help available to you, either in the form of medicines or active physiotherapy and some amount of psychiatric help. Once a COVID hits you, and if it hits you badly, you virtually get shaken up. Your life subsequently is a second life. So the medical field has added years into your existence, but we want to add life into those years which you have got. And therefore, all of us need to work together.
Very well said, sir. I must say, putting life back into individuals is going to be a tough task for all of us. From our point of view or from our side, if there is anything that we can do, we would be happy to support in your endeavors, sir. Support in the endeavors of the task force. On our own, what we can commit is that we are not going to do something stupid whereby the healthcare infrastructure gets overwhelmed. I think that's a commitment from all of us as compliance professionals or corporate compliance professionals. We will not do anything stupid that puts more pressure onto the current infrastructure, facilities, and doctors. Sir, I'm really overwhelmed, and I'm so grateful that you've shared this with all of us. That no words are enough for me, honestly, sir. And I think thank you and thank you again and again is the only thing that I can express myself. Post kind of lockdown getting released, I will come and take the liberty of seeing you personally, and I'm sure we'll exchange notes on what all has happened and what all ought to have been done correctly. More importantly, sir, from each one's perspective, I think the COVID has taught us things which otherwise we would never have learned. And those are all good things. I've had discussions with Dr. Mashalkar just now, and I think we looked at what are the opportunities for corporate sector today to look at things positively. And as an optimist, I think we are moving in a very, very positive direction in terms of making this world better for everyone. I'm really grateful and thank you very much, sir.
Thank you. Thanks.
Namaste, ladies and gentlemen. I have the privilege and honor to welcome Mr. Prakash Singh amidst us. Mr. Prakash Singh needs no introduction, but yet I cannot help but introduce him a little bit to you all. He has been one of the most distinguished IPS officers that the history of independent India has seen. He retired as DG BSF, he was DGP Uttar Pradesh, and he was also DGP Assam. And even after retirement, he has tirelessly and relentlessly pursued police reforms in this country. Consequently, in 1996, he filed a petition in the Supreme Court, a PIL, with some others, and the judgment of that petition came in 2006, in which the Supreme Court was pleased to direct all the states in the country to bring about police reforms on certain parameters, on certain points. This would make the police effective, efficient, and people-friendly, and insulated from political interference. To you, sir, a little bit about the event and also our audience, Compliance 1010 is also an historical event for us in Legacies as well as the corporate world. It is the brainchild of Mr. Suhas Tuljapurkar, who is a well-known corporate lawyer, and as I choose to call him, an ideologue par excellence in terms of compliance. He conceived of this idea of promoting the culture of compliance through this event on the 10th day of the 10th month every year. Now, so that translates into 1010, and this 1010 becomes also symbolical in terms of compliance, that compliance has to be 10 out of 10, and even one non-compliance can lead to devastating results. During this occasion, we reward compliance professionals, ethical companies, compliant companies, and this year we are proud to say that we are giving out 80 awards. These are 80 awards means that we are lighting 80 candles to dispel the darkness of non-compliance. And we hope that through these 80 candles and the people who watch the program, the day-long program that we'll be holding, to become more and more compliant and therefore spread the culture of compliance in the entire Indian corporate world. The highest award is given as the Compliance Crusader Award, and I'm happy to inform you that this reward has been given to such industry stalwarts as Dr. Mashelkar, Mr. Damodaran, Mr. Narayan Murthy, Mr. Deepak Parekh, Ms. Anu Aga, and Mr. Adi Godrej in the past. We thought of organizing this little small event to express on behalf of Legacies, Bombay Stock Exchange, who is our event partner, and more than 1,000 companies, to honor and express our gratitude, the Indian police force that has stood by us in this challenging times of COVID, of this pandemic. In fact, they have risked a lot in terms of deaths and having been affected by the pandemic, by the virus, and yet they continued to serve us and to keep us safe. With these few words, sir, I would hand over to you to give us your message on this occasion. Over to you, Prakash Singh, sir. Thank you.
Thank you, Ramesh, for introducing me. And I would like to express my gratitude to Legacies for having organized this event. And through this event, the recognition which they are extending to the policemen who have performed extremely difficult and I would even say hazardous duties during the current pandemic. Now, this pandemic was a new challenge for us, an absolutely new kind of uh, situation was thrown up, a situation to deal with which we had no standing orders, there were no SOPs, there were no standing operating procedures. So we really had to start from the scratch. And actually, most of the officers, whatever they did purely with their own individual initiative. The government had issued certain orders, regulatory orders about how the lockdown is to be enforced. So the police was entrusted with the unpleasant duty of enforcing the lockdown and ensuring that people stay behind doors and do not come out in breach thereof. So the regulatory orders were enforced. In the process, of course, there were some difficulties initially, but then the Indian Police Foundation, we took stock of the situation and we issued some kind of advisory to all the director generals of the various states on what all they need to do, what all precautions they should take. And I must say they responded to our instructions and subsequently we found that the police performance improved in the sense that not only we enforced the clamp down, not only we enforced the rules promulgated by the state governments that people should wear masks, that they should observe social distancing, that they should not come out beyond certain hours, that they should observe rules of quarantine, etc., etc. I mean, all the regulatory orders were enforced. But what was most heartening was that the police went out of their way to extend humanitarian assistance to people in need. I mean, senior citizens who were confined within the four walls of their house, medicines were it was ensured that they get their essential supplies of medicines. Wherever provisions had to be distributed, we saw to it that the supply chain runs smoothly. Then there was massive movement of migrant labor. We had to deal with this massive movement of people from one state to another. And not that we could do much help, but still whatever little help we could extend by way of arranging transport for them, ensuring shelter for them, arranging food for them, all that was done by the police. I mean, the police, really went out of their way. And what we saw was police in a new avatar, in a new form, in a new shape, a new face of the police we saw. And in fact, it restored the faith of many of us in the police and its ability and capacity to rise to the occasion. See, here was a situation, a formidable challenge, and there were no SOPs, as I said, and yet we rose to the occasion and when we won the hearts of the people. Our popularity index went up, and in terms of confidence, we won the confidence of lots and lots of people, as the pollsters indicated. Our role was recognized by the media, and one leading newspaper of the country, they said, the police are the front line of the front line, which was, I think, saying a lot. Even the Prime Minister recognized our contribution, and he said that the pandemic has shown the sensitive and the humane side of the police, and that has touched our hearts. So this compliment coming from the Prime Minister was a tribute to our functioning, our role, and our performance during the pandemic. But so far, you'll be, I'm sorry to share this information, but more than 700 police and central armed police personnel have lost their lives due to pandemic because they are all the time in touch with people. I mean, we can't say that, no, we will work from home. We have to go out. We have to meet with people. We have to interact with them. We come into contact with them and in the process of extending them assistance. So these people have 700 police and central armed police personnel have laid down their lives. On this occasion, we pay homage to them. And I would only, my request and message for the people of the country is that you should have faith in the police. And in a situation where there are no external pressures, we appear in a new avatar, which you also find very friendly, very people friendly. And This is the kind of environment that we want for ourselves, an environment where police, under normal circumstances, works without any external or outside pressures. With this is my message to all of you. And I once again thank Legasis for giving me this opportunity and for giving recognition to the great work which policemen have done in this crisis. Thank you.
Thank you very much, sir. We are really honored for all the message that you have given to us. And I'm sure we will all follow what you have conveyed just now to us. Thank you very much.
We have with us Dr. Chinmay Parle, a postgraduate student, or let's say a person who's passed post-graduation and is working in KEM relentlessly from the beginning of lockdown, from the times that we have been remaining safe in the house. I think it's Dr. Chinmay who's been working for us, fighting at the front line. He's one of those COVID warriors who we actually owe our life to. Thank you very much, Dr. Chinmay, for joining us. And thanks for, I think the words are not enough. We might say thank you again and again. We express our gratitude to doctors like you. That's not enough. But we want to hear from you what has been your experience, and more importantly, as in the future, what is it that you would want us to do? One thing is for sure, we're not going to do anything stupid that puts more pressure onto you. That's the commitment on behalf of various of our audiences as well as various corporate executives. Over to you, Chinmay.
Good evening, sir. Good evening, Suhas, sir. At the outset, I would like to thank you and thank Legacies. This is really a wonderful initiative. So I would like to say some of my experiences that I have experienced in the last 4-5 months. I have been working since March now, since the last week of March when the lockdown was first announced. So I am a postgraduate resident who is working in KEM hospital since the last 9 years. And I have seen a lot of epidemics. But this COVID-19 pandemic is something that the world has never experienced before. And for us at the ground level, it was something very different than what it is for other people who are sitting in their homes in the lockdown. So in the beginning, when it all started in March last week, say 25th March, when the lockdown was announced, I was there, and the number of patients was not so much, but the other problems, the logistical problems that we had at that time were a lot. And those problems was apparently simple. We didn't have food. This is a basic problem. It is a basic necessity. So all the doctors in KEM hospital, say some 200, 300 doctors, we did not have foods because there were no hotels, there were no canteens. Our dabbawalas had stopped giving us dabbas. So at that time, Taj Group, Tata Group started giving us tiffins twice a day for the relatives, for the patients, and for the doctors. So those 2 meals were the only thing that we had in the first 15 days of April. We used to eat half of the tiffin, then the rest of we used to save it for the next day's breakfast, and that is how it was. Things started getting better eventually, but then the patient load started increasing. So the numbers went in thousands, and every day counts. Initially 10 patients per day, 100, then 100 patients per day, then 500, and then 1,000 patients. Mumbai being a very populated city, very dense city, it spread like anything, spread like wildfire. So we had a lot of problems isolating these patients, and with the medical resource there being limited, with there being a limited number of doctors working, we had to work long hours, and we did not have any problem working long hours per se, but in that PPE it was very difficult. We used to get all sweaty, hungry, thirsty, and we had to suppress all that and keep working. And what happened is, gradually this pool of doctors that we had, it started getting exhausted. Some of us started falling sick. Some of us left for their homes. Some had other family issues. And we realized that if this pandemic is progressing at this rate, and if this is what is happening to doctors, then something has to be done about it. So then we had to fall into administrative stuff also. We had to form our own committee. We had to form an HR committee in a hospital. We had to divide all the pool, depending on the seniority, the experience, into 3 groups. And then we had to, distribute the working hours. and distribute the medical resource so that the medical care is also not compromised, and yet as doctors we stay healthy. And while all this was going on our personal levels, what we saw was that the patient's condition there is even worse. Most of the patients in the initial months, most of the patients who were brought to a municipal medical setup were abandoned. So the families were scared of keeping the parents, COVID positive parents, taking them back once we were ready to discharge them. And no one, a lot of patients just lay there unaccompanied for many days, multiple days altogether. Some of them, the very old ones, we didn't even know their names. We didn't know what to do. So the social stigma is something that I think has plagued the society. So one message that I would like to give all of us here is that this is the principal thing that we have to avoid, because this pandemic, it has not discriminated. It has not seen any particular age, any particular caste, any particular religion. So today someone else is affected, tomorrow it might be one of us. So it is important that we are in this as a group and we take care of each other as as human beings. So that is one thing that I would like to tell you. And yes, eventually things have started improving. The lockdown has almost ended, and it has opened, everything has started opening up, but we have to be responsible still. The pandemic has not gone yet. The cases are still increasing. So simple measures, hand washing, wearing masks, using sanitizers is something that does not take a lot of time, but it is going to help us a lot in the long run. So this is what I would like to say, that practice social distancing. Even if everything has opened up, try to avoid social gatherings and try to be responsible citizens first, because it is not about us, it is about the community as a whole.
Thank you very much. Thanks a lot, Chinmay, for this take. I think this has actually opened up eyes, and very few of us know actually and understand what plight the doctors have undergone during this period. Thank you very much for sharing this with us. All the best for the future.
Thank you, sir.
Stay safe. Stay safe for us. Thank you very much, Chinmay. Be in touch.
Thank you.
Good morning, good afternoon, good evening. Welcome everybody at Compliance 1010. We have with us, Dr. R.R. Gangakhedka, and I think at least 1.3 billion Indians know him very well by now. He's been at the forefront of when the lockdown started, at the forefront of all the efforts on behalf of ICMR. And I think we all know the kind of hard work that has gone into at the right from beginning of the lockdown in terms of COVID-19. In Compliance 1010, this has been our tradition that as legacies, we've been expressing our thank you to all the COVID warriors, all those frontliners who have been fighting to keep us safe, who are actually rendering selfless service, notwithstanding the number of hours they have to put up, notwithstanding the difficulties that we are facing as a nation. I think it is our duty, and on behalf of 1,000+ Indian corporates and Bombay Stock Exchange, I take this liberty of expressing our gratitude to Dr. Gangakhedka. Sir, it has been actually a very overwhelming situation for all of us. More importantly, I think this is not a black swan event, it's a black elephant, because we didn't realize the size with which this catastrophe has hit us. On one hand, I think all of us are struggling. On the other hand, we are trying to find new norm. And in all this, I think we must say thank you, and thank you is not enough for all those doctors who have selflessly worked, for all those healthcare specialists, healthcare workers who have rendered these services to us to keep us safe. Some of them have lost their lives. We understand that the pain and agony that their families would be undergoing. We are conscious of the fact that not only the LEOs, that the law enforcement officers, but there are various other stakeholders in the community who are trying to keep us safe. We have been safe because you've been there, sir. So, on behalf of the doctors community and healthcare specialists, I would request you to accept our gratitude. I couldn't possibly think of any other person than you who can accept this on their behalf. The amount of work and the kind of trend that you have set in at the beginning of the lockdown, which has a sustainable effect all through, and it has a positive cascading effect till now that we have experienced. Sir, thank you very much. And no words are sufficient to say this.
Thank
Over.
you. I thank you all on behalf of all the healthcare workers who are my brothers and sisters who work with me as a medical fraternity, and also other frontline workers. I thank BSc Legacies to think it appropriate to actually appreciate the role that they are playing as of now. To me, compliance and ethics were part of my life. It's part of our lifestyle. If you look at compliance, one of the best examples that you perhaps see is in I actually worked in HIV for almost more than 3.5 decades. Now, one of the things which we could ensure only because of adherence related issues or compliance to the medications that was given, we could think in terms of controlling HIV to a tune that today we think HIV is an elimination target for 2030, despite the fact that this is also a viral disease, this was also a multisystemic disease, this was also one which didn't have vaccine, this also didn't have any curative approach available whereby we could make a difference. But this was only whatever medications were available, people were compliant to them. Whatever was being told for preventive measures, that was also followed rigorously by patients, and the result is very much visible today. One must remember that adherence is a critical thing in life. Now, one of the things when I was working at National AIDS Research Institute, along with all my scientists, our adherence to the SOPs, standard operating procedures, ensured that National AIDS Research Institute becomes the fourth laboratory in the world to actually be accredited by World Health Organization for testing any in vitro tests and accrediting them that they are worth using against HIV, hepatitis B, hepatitis C, and human papillomavirus infection. If you look at clinical trials, you also find that we are almost all the time audited by the monitors that are there to ensure that we adhere to the standard operating procedures. We don't deviate because one must understand that any deviation would always lead to an issue whether we can provide that medicine with confidence to people when you want to use them. Ethics are also extremely important because ethics, if you follow ethics, we know for sure that there is no bias and we can actually try and think in terms of providing the medicine or vaccine to others. The best example today is non-compliance. If you were to think in terms of, you see the adversities that we are facing. Actually, if you look at Semmelweis, one of the early scientists who showed the importance of hand hygiene in 18th century, that if you use hand hygiene, women, pregnant women, would perhaps not suffer from infections and perhaps reduce the mortality to a larger extent. We didn't pay much of importance to the same until the 20th century started. We had to be reminded again, no, despite the fact that we understood importance of hygiene. Now, if you think we had earlier SARS, where it was emphasized, we had MERS, where it was emphasized. We followed it rigorously only at that time. And again, we forgot. And today, COVID-19 is another example of non-compliance. But I am sure my brothers are working extremely well. The lockdown actually led to a shift of this curve of outbreak to a tune that you could find that the healthcare workers' capacity could be augmented, the hospitals' capacity could be augmented. Industry responded tremendously well. To we didn't have so many personal protective equipment, neither diagnostic reagents. But what was done was we asked people to respond, and industry became Atmanirbhar, and today we are exporters of the same. Doctors today are under tremendous pressure. They follow their checklist. They are compliant with their own checklist of management. Today, despite the fact that we are second largest country in the world, the numbers, though they appear to be too large when you compare it with other countries as such, but the truth is, being second largest, we are still able to reduce, we are still able to ensure that the mortality numbers are fairly smaller compared to others. And it's all due to doctors. Their devotion to the checklist, their compliance, despite the fact that there is a tremendous threat to their own lives. But it is just compliance and ethics of human values which are making difference. And on behalf of that fraternity, I accept this award and dedicate it to all my seen and unseen frontline workers, and hope that all of us will strive together. Even the people will become compliant to the advice that is being given about practice of COVID appropriate behavior, and we will be able to successfully counter the spread of this particular dreaded pandemic, COVID-19. Thanks once again.
Thank you very much, sir. Actually, it is our pleasure, privilege, and honor to recognize you and say thank you. So, as I said, no words are sufficient, but it's just an expression of gratitude. Thank you very much, sir. Is there any message that you have to give to us? Because I think we are we are trying from our own end not to overwhelm the healthcare infrastructure and facilities by doing something stupid. You see, we're trying to avoid that stupidity, uh, notwithstanding whether we work from home or we don't travel now. But I think, is there any one message that you would want to give us? Because people are still scared. They believe that the challenge is not over, neither it is halfway through. Any message that you want to give to a larger community and Indian corporates?
Two messages that I would pass off. One, what is most important for one to recognize that it is not only government that is responsible for your own health. It should be you yourself. Everything is in your hand. Now, what you just need to do is not going to cost you much. It's not going to be difficult to practice. But if you do it, you will perhaps save all those who are your near and dear ones, including your own self and the community. It is time we become responsible for health ourselves and not only depend or point blames or fingers towards government that it is not able to do it. It will never be able to do it if we don't become partners to the government. You will never be able to stop this particular infection. The second thing which I would say is, please understand, as the lockdown is being lifted, now the festivities will start. If you want to remain in festive mood, please take COVID appropriate behaviors very seriously. If you don't practice, you yourself will reduce these festivities to things which I would not like to speak in words, but please don't do that. If we do all work together, I'm sure this challenge can be overcome. It's only a question of time. No, we have to be patient. We have to accept that there will be some sufferings, but this is only for you, your family, and the community. Thank you.
थँक यू व्हेरी मच सर. मराठीत म्हणतात तसं तुमचं काम प्रचंड आहे. वी ऑल नो दॅट यू हॅव ट्रिमेंडस वर्क बिहाइंड यू. You have tremendous experience, whether it is from Johns Hopkins, Baltimore to New Delhi to Pune. Sir, it's our pleasure, privilege, and really, you have increased our value quotient in compliance 1010. Sir, thank you very much for being with us, and thank you for accepting this on
Thank you.
behalf of the healthcare experts. Thank you very much.
Thank you.